introduce Mr. Jonathan G. Earnest, Director of Admission at the Gillings School of Global Public Health. Mr. Earnest will provide in-depth overview of the academic programs offered at Gillings and also the application processes and the detailed support system that's available for students at UNC Gillings School. Mr. Earnest, the floor is yours and you have 25 minutes for your presentation. Thank you.
Excellent. Thank you so much, Sylvia, and thank you again for all your efforts to coordinate this event. I'm very happy to be with you all this morning and to speak with you about our programs. I'm going to share my screen so that you can follow along with the slides that I'm going to cover. So hopefully everyone can see that now. Is it showing?
Yes.
Excellent. What I want to do is talk with you all a little bit about our school as a whole. I'm going to cover the different degree programs that we offer at the graduate level. I'm going to speak specifically about the Master of Public Health a little bit more in depth because it is our largest degree program with the most students. And then I'm going to cover some of the student support efforts that we do just so that you understand how we surround our students with support throughout their time in the program. So that's where we'll go today. And of course, if there are questions or anything, we'll have time at the end, as Sylvia mentioned, for Q&A. So just to introduce myself again, I'm Jonathan Earnest. I serve as the Director of Admissions at the School of Public Health at UNC Chapel Hill. I've been in this role for 2 years, but I've been at the Gillings School for 7 years now. I've been at Carolina for 13 years now, which is hard to believe. And I've worked in admissions for about 16 years now. So I'm starting to get old in the work that I do, but I love it. And I'm, again, excited to be here with you all to talk about these things. Just to start, again, talking a little bit about our school, we are very well known for the research that we conduct in the field of public health, which, as many of you probably know, the field of public health is very transdisciplinary. So it covers many of those different field areas that were mentioned earlier that are very popular amongst students from Indonesia, especially. We have a very great track record when it comes to securing funding through research grants and those kinds of things. So I wanted to share some of those figures here with you, and also to note that we are ranked consistently as the #1 public school of public health, which we're very proud of. And I always preface that with saying that rankings are numbers, but the important factors are what got us to those rankings, what makes us special, what makes us #1 repeatedly. And so I hope by the time that this event is over, you can see all of the many reasons why we are consistently the #1 public school of public health. So again, speaking a little bit about the global health research that we do at the school, we do have more than 80 faculty members who are doing work around the globe. We have quite a few research dollars that go into the work that we're doing. And this is work that it's not just our faculty, but our students are actively engaging in as well. So you as future students of the school could be contributing to this, just as Sylvia is. We have over 30 countries where faculty were working last year alone, actively engaging in that research. These are some of the research strengths. And so if you see anything on this slide that it calls out to you that is of interest to you, that you could see yourself potentially pursuing, there is something for you at the school. We have quite a few active projects going on in all of these different areas, and they're split across many different departments, which I'll talk about shortly. Through our different degree programs. Some of our students are more focused on the research side of things, and some are more focused on the practice or intervention side of things, where they're actually going out and implementing the research that others are doing. So there's quite a lot of different ways that you can be involved in public health as a student through our school. So I want to talk a little bit about the different degree programs, and I have a couple of slides to help do that. We are a relatively small school of public health, but we have quite a bit of structure to us. So we have our undergraduate programs, which there are 5 different majors that we offer for undergraduate students. We have our Master of Public Health, or MPH degree, which is much more of that practitioner-based degree that I mentioned before. It is our largest degree program. And then we have our other master's programs, which are much smaller in scale, and those would include the Master of Healthcare Administration, which involves much more of the business management side of things within healthcare. We have Master of Science programs, which are more research-based. our Master of Science in Clinical Research, which is developed specifically for practicing physicians who want to learn more about the research side of practice in that regard. We have a Master of Science in Environmental Engineering. So that deals a lot with climate and air quality, water quality, and health outcomes as it relates to the environment. And then we have a Master of Science in Public Health in our Health Behavior Department, as well as in our Health Policy and Management Department. And I'll cover all of these in a bit more detail. We have a Master's to Doctoral program in our Health Behavior Department. So if you're interested in pursuing research long-term in the field of health behavior, there is a pathway to that doctoral program with this Master's to Doctoral. And then we have 8 different doctoral programs at the school. There are 7 that are based in departments that are research-based, PhD programs, as you might know them. And then there is a program that is a little unique that's called our DRPH, or Doctor of Public Health. That program is a practitioner-based doctoral degree, and it's something that is quite different in the sense that there's still research involved, but it's primarily for folks who are wanting to pursue a doctorate and stay in the field of practice in public health. Typically, these folks have more than 5 years post-master's experience that are working in the field and getting experience that way. So those are the different degrees that we offer. As I said, there are quite a few. I laid them out on this slide just to give you a sense of where they fall in the different disciplines. And so I have on the top row here all of the different departments that we offer. So from the left to right, you'll see biostatistics, epidemiology, environmental sciences and engineering. HB stands for health behavior. We have HPM, or health policy and management. We have maternal, child, and family health. There's nutrition, and then there's public health leadership and practice. And so you can see the different degrees that fall under each one of these. Again, just trying to lay these out so that you can see the depth and breadth of the school. We have a number of accelerated dual degree programs in the bottom left corner. There are several other dual degree programs that we work with schools across the University of North Carolina, Chapel Hill. And then there's multiple certificate programs that students pursue either while they're in their other degree programs or after they've completed those programs. So quite a few opportunities for you at the school. And again, I think it's helpful just for visual to see the different degree programs laid out on this continuum. I know it's helpful for me when I talk about them. So again, we have a variety of degrees, and they range from programs that are much more research focused. So the Doctor of Philosophy or PhD programs that I referenced earlier, and then moving more into like the Master of Science and the Master of Science in Public Health. The further we get to the right of this slide, we get closer to more practice-based degrees or practitioner-based degrees, where students are focused less on research and more on implementing that research and practicing in public health. We have a number of our degrees that I would classify as specialization degrees, which you can see at the bottom here as well, which I've named already. But again, those are good to see just kind of where they fall on that continuum between research and practice. So what I'll do now is cover the different departments at the school and the degrees that they have within them. I'm not going to spend a whole lot of time on this because I know there'll be more opportunity in the Q&A if there are questions about anything specific. So I'll just mention in our Department of Biostatistics, you can see on here, there's a number of details about the programs that they offer. They have a PhD as well as a Master of Science, and I've got the deadlines listed here on each one of these slides too, because each one of them is slightly different. And so what I want you to think about as I'm moving through these is if there's a particular discipline or degree program that is of interest to you, certainly let us know as we're talking this morning and covering all of this information for you so you can plan ahead. But do note these deadlines that are listed on here because some of them are much earlier than others, and it's important to plan ahead. The PhD programs that I'll talk about are all very different in this structure of how they do their admissions as well. So I'll talk a little bit about those application processes. The next slide here is our Environmental Sciences and Engineering Department. They do have 3 different degree programs that are available currently: the Master of Science, the Master of Science in Environmental Engineering, and the Doctor of Philosophy or PhD. We are the nation's first engineering department within a school of public health, which is a very exciting draw for us. And I'm sure Sylvia will be able to tell you more about her experience in the program here. I've listed the cohort size, which is also helpful. So you can see how many students are admitted to these various degree programs each cycle on average. it is a very competitive school with varying levels of competitiveness across degree programs. So it's important to note there's not necessarily minimum criteria and you're admitted. You do have to be competitive for those programs. I know all of you here are going to be competitive applicants because you are a part of this program and interested in it. So I am sure that you all have many great things that you can bring to the programs that you might be applying to. And we can talk about how that factors into your admissions decision as well. The next department here is the epidemiology department. We have quite a bit of research happening in our epidemiology department. And just as we've moved through this global pandemic in the last 5 years, you probably heard a lot about UNC Chapel Hill and the work that we're doing to help fight COVID-19 and all of the things that have happened since. So a lot of students that are focused on epi as a very large field of study within public health. I've got some information here again about these deadlines for these different programs. And I'll mention that the Master of Science in Clinical Research, once again, is specifically for practicing physicians. So that may be a little bit different in terms of its scope, but the PhD, of course, is a very popular program with a lot of different research areas within epidemiology. So we're thinking large population studies within all these different subdisciplines. When you apply to this program, you can actually indicate which one of these, or maybe there's more than one areas of interest that you have when it comes to research. What's unique about our epi department is for the PhD program, we admit around 25 to 30 students each cycle, which is a fairly large program. And we don't require that you match with the faculty member in the admissions process. Instead, we have you go through a full year of the program, kind of exploring your interests and narrowing down your faculty mentor at that point. So that is a little bit different than how most PhD programs in epidemiology operate. We have our health behavior department, which has again, the Master of Science in Public Health to PhD for anyone who does not yet have a master's, and a PhD standalone program. Many of these programs that I'm speaking of do not require that you have a master's to enroll, but each one of them is slightly different. So again, if there's interest in a particular program, it's good to ask some specific questions when we get to Q&A. And again, the funding varies from program to program as well in terms of what that looks like. It's great if you're able to secure scholarships like what we're talking about this evening, because that can certainly help fund your time in the program and relocation and whatnot. Again, there's a lot of different depth and breadth that happens within health behavior. You can see all the different research topics that are listed here on this slide. I won't read them to you, but definitely helpful to see what all is entailed within our school. Health policy and management has a number of degrees as well. I mentioned all of these before. Our DRPH, or Doctor of Public Health program, is that unique doctoral program that I mentioned that's more practitioner-based. You can see the various cohort sizes listed here as well, and the different levels of funding that is typically available to students. Health policy and management does tend to bridge both the policy side of things within the public health world, which I always say policy makes the world go round. Policy is my love language when it comes to public health. It's a really important thing to study and to learn no matter what area you're a part of. But then also those business management skills, which were one of those primary areas that were mentioned earlier within the field. Just to talk a little again about the DRPH program, there are some very specific things that go into this particular program being specifically for people who are 5 years postmasters working in the field in some kind of mid to senior level management position. So again, we can talk more if there's interest in that particular program. Maternal, child, and family health, I want to mention as a department, again, they have quite a few areas of research that they focus in. So you can see those areas listed here. The only degree that they specifically offer is the PhD or Doctor of Philosophy program. And they do have a preference for students who have a master's already. They are the only standalone department of maternal and child health in our country, which is, I think, a good testament to the amount of research that they're capable of doing, the funding that's available to their students, and the wide range of resources that you would have available to you as a student within this department. So again, wanted to mention them. And then nutrition is our last department that I'm going to cover tonight. This department does have a Master of Science as well as a Doctor of Philosophy program. And what's interesting about nutrition is that it's the only department of nutrition in the entire country that is in both a school of public health and a school of medicine. So many of our faculty members are cross-trained in the School of Medicine, working as physicians, working in the hospital setting or clinician. And our students are studying a wide range of aspects of nutrition, everything from biological sciences to epidemiological nutrition to things that are more policy and intervention based. So you can see there are different research areas listed here. So the last program that I wanted to mention specifically was our Master of Public Health program. It is our largest degree program once again. And while it is one degree, it is housed at the school level. It's not housed in any one specific department, but there are quite a few different concentrations that you can choose from when you apply. So you can see all of those listed here on this slide. And some of these do live within one of our departments that I've already named. Some of them live across multiple departments and are transdisciplinary in nature because, again, that's the nature of public health. So I won't go into all of these in detail, but just know that each one of these concentrations is looking for something slightly different or unique in their admissions processes. So it's good to become familiar with the concentration or concentrations that interest you so you know how to apply. This is just a little bit of a visual of the degree requirements and the coursework that you would take in this particular degree. I won't spend too much time on this because I want to make sure that we have time again towards the end for the Q&A. But when it comes to your application, the Master of Public Health degree program is slightly different. We have a common application that we use for public health programs for the NPH called SOPHIS. And so there's a two-step process. You would complete the SOPHIS application using the priority or the final deadlines that are listed here. And then the second step is to fill out our UNC graduate school application, which I'll talk about on the next slide. But the components of this application for the NPH, you do have to pay the application fee for both this program, the SOPHIS program, as well as the UNC graduate application fee. You're required to submit a statement of purpose as well as your resume or CV, your transcripts, and then any foreign transcripts are required to have a WES evaluation. That's the World Evaluation Services evaluation. And then 3 letters of recommendation. We get a lot of questions about the letters of recommendation. Who do they need to come from? I think it's important to consider your circumstances and your context in choosing who you have write your letters of recommendation. If you have been to school recently within the last couple of years, it's wise to have at least 1 or 2 academic references from maybe your previous graduate program, or if you're coming directly from your undergraduate program, to have someone there too. That can speak to your academic skills. If you've been in the workforce, then obviously those are going to be very important as well to be able to talk about your work ethic and the skills that you bring to the table. Perhaps you are applying to a research program and you've worked in a research lab of some sort. Someone who supervised you in that capacity could be a very good recommender as well. We do have the TOEFL and IELTS minimum scores that are listed here, unless you qualify for an exception for that. And then something that I like to make sure that I mention, because we talked about standardized testing earlier, none of the programs at the Gillings School of Global Public Health require a GRE. So you do not need to take the GRE. It is not a part of our admissions processes, which is good news because it's less preparation that you have to do in your application, and it's less costly in that the GRE is fairly expensive. So the UNC graduate school application is, again, the second part of that MPH application. It's the only application you have to do for all of our other graduate degree programs. Those deadlines vary. So again, those were all on those slides, and I can share those with you or have Sylvia have those sent out to anyone who participated this morning for this session. But you can see, again, similar requirements. Each different degree program has a different statement of purpose, questions that they ask. You are expected to upload a resume or CV, so we know more about your background, your experience, and that kind of thing. And again, transcripts, letters of recommendation. And some of our degree programs, specifically in the PhD area, might require an interview as well for your acceptance, or a faculty match. And so 2 of our departments that I mentioned earlier, environmental sciences and engineering, as well as the nutrition department, do require you to have that faculty match to be admitted. And so it's wise, if you're applying to either of those programs, to be contacting faculty members early in the process and trying to get to know them so that you can find if there is a match for you in that process. You can be a super stellar applicant on paper, but if you don't have that match where it's required, it can hinder your ability to be admitted. So we can talk more about that too if there's questions. And I'm sure Sylvia can share some of her experience with that too. I did want to share just a listing of some of the different career paths that our graduates take. We have a great success rate for students, both foreign and domestic, when it comes to our career placement. So 99% of our graduates do have a job or continue their education within 1 year of graduating. And you can see they're working in a lot of really amazing fields, a lot of really great titles, and doing really important work globally to help improve health outcomes across the board. And I think that that's really what it's all about, because our mission at the school is really to improve those health outcomes for everyone and create a more equitable world. So lastly, I mentioned I want to talk a little bit about the student support that is available to you. My office, the admissions office, does work through our student affairs unit at the school. We provide a lot of different opportunities for students to connect and network and get to know one another, support one another, and find support through other resources. So many of those are workshops or support pods for people in different affinity groups, so that you can, again, be connected with others. We have career services. So currently there are 2 career service coordinators that work at the school level that help students not only as they are in their programs, but also once they've graduated. So you can receive that consistent support even once you finished your program, trying to get into your jobs or practicing your interviewing skills or having resumes looked over and those kinds of things. We do have academic advising. We have 11 different academic coordinators that are assigned based on degree programs to help our students moving through those programs and navigating the process. I always mention to students that these are full-time staff members that are hired and paid to specifically help you navigate that process. I am currently a full-time employee of the university, but I'm also a part-time doctoral student myself, so I know what it is like to go to school and to be in a graduate program. And I can tell you that it is really helpful to have someone that is able to walk you through and answer your questions when you don't know who to ask, when you don't know what to do about a particular issue. You have that academic coordinator that can assist you with it. We also have a funding coordinator that works with our scholarships office that is specific to our school. So she is a great resource as well. We have 2 full-time mental health coordinators that exist on our school's campus that are specifically for Gillings students, which is helpful. Mental health is really important to make sure that you're taking care of yourself physically and mentally and spiritually as you're going through your programs. Student organizations, we have quite a few at the school, over 40 student organizations that you can belong to just at the Gillings School alone. There are over several thousand at the university that you could belong to if you want to. And these are everything from sports and those kinds of clubs to religious organizations or philanthropic organizations, some that are specific to public health that are on this next slide here. But wanted to mention those specifically, and then international student support as well. So there is a link that I'm going to put in the chat here because I think it will be helpful for folks to see. See if I can get to the chat here. I am going to pop that in the chat so that you can. Well, this first link that I'm putting in the chat is a information form, which I'll mention in just a moment. Sorry, that was copied already. But that is where you can actually provide your information to us and join our mailing list if you'd like to learn more about our programs through our emails and campaigns. And then the other link that I'm placing in the chat is our international student support link. So there's quite a bit of references and resources available to students there. And you can learn more about funding and student support and those kinds of things specifically for international students. The next slide here, again, just lists some of these student organizations and ways to get involved. Again, being a student is not just about going to class, it's about many of the things that happen outside of the classroom and the ways that you can learn and connect with others through those. So we just want to make sure that our students are aware how important that is to your life as a student with us. And then lastly, just wanted to share, again, my contact information, which I'll be here for the Q&A and can answer questions then as well. But we have our social media available for folks if you would like to connect with us on that and see some of our student stories that we've posted there or connect with others through that. But again, I appreciate you all's attention this morning and the time that I've been able to share with you. And I will be around for the Q&A session next. Okay. Thank you so much, Sylvia. I'll turn it back to you.